Hello, my name is Dr. Dewan S. Raja. Today I will discuss about insulin resistance. Insulin resistance is the failure of target tissues to respond normally to insulin. What are the target tissues of insulin? These are the skeletal muscle, liver, and adipose tissue. Insulin is a hormone produced by the beta cells of the islets of Langerhans of the pancreas. Insulin plays a crucial role in regulating blood sugar glucose level by facilitating the uptake of glucose into liver, skeletal muscle, and adipose cell. When cells become resistant to insulin, it means that they don't respond as effectively and higher levels of insulin are needed to keep blood sugar level in check. So in insulin resistance, blood level of insulin is not less, rather it is more than normal. Only the target tissue is unable to use the glucose in because of the resistance, insulin resistance. What are the causes of insulin resistance? Obesity, overweight, especially excess visceral adiposity, excess glucocorticoid, Cushing syndrome or steroid therapy may be associated with antipsychotic drug, may be associated with that of anti-HIV drug. There may be insulin resistance, excess growth hormone, acromegaly, or it may be gigantism. Acromegaly is a condition of high growth hormone level after the closure of the epiphysis. If it is before the closure of the epiphysis of the long bone, then we call it gigantism. In both conditions, there is insulin resistance and hyperglycemia that may lead to diabetes mellitus. Polycystic ovarian disease is also an association with that of insulin resistance. Lipodystrophy, acquired or genetic, associated with lipid accumulation in liver. Autoantibodies to insulin receptor. Mutation of insulin receptor. Mutation of peroxisome proliferators, activator receptor gamma, PPAR gamma. Mutation that cause genetic obesity, that is melanocortin receptor mutation. Hemochromatosis, a hereditary disease that causes tissue iron accumulation. Okay, so these are some of the causes of insulin resistance as described the Guyton and Hall textbook of medical physiology, 14th edition. Okay, what are the symptoms of insulin resistance? Abdominal obesity, so abdomen will be protruded. Okay, so abdominal, there will be fat around the viscera of the abdomen will be protruded. Difficulty losing body weight, craving for sugar or carbohydrate rich foods, fatty liver, chronic fatigue or low energy, brain fog, so thinking process will be disturbed. Okay, high blood sugar level, skin tags. We may also get acanthosis nigrans. Okay, there may be some excessive pigmentation plus skin tag, dark patches on the skin, that is the acanthosis nigrans, high blood pressure, polyuria or frequent urination, thirsty all the time. These are the symptoms of insulin resistance, but it may be asymptomatic. It may be diagnosed in the doctor's office. Insulin resistance beyond type 2 diabetes. Other than diabetes, we may have association of polycystic ovarian disease, inflammation of the lung, atherosclerosis, heartburn, low high density lipoprotein or good lipoprotein will be low, cirrhosis, constipation, hypertension, cardiomyopathy, elevated blood sugar, elevated triglyceride, increase of intra-abdominal fat. So these are the insulin resistance beyond type 2 diabetes. Certainly type 2 diabetes is very important, but we may get this all. What is the pathogenesis of insulin resistance? Failure to inhibit endogenous glucose production, that is gluconeogenesis, in the liver, which contribute to high fasting blood glucose level. So, gluconeogenesis is not inhibited. What is gluconeogenesis? That is the production of glucose other than glycogen. Failure of glucose uptake and glycogen synthesis to occur in skeletal muscle following a meal, which contributes to high postprandial blood glucose level. Failure to inhibit activation of hormone-sensitive lipases in adipose tissue, leading to excess triglyceride breakdown in adipocyte and high levels of circulating free fatty acids. A variety of functional defects in the insulin signaling pathway underlie insulin resistance, reduced tyrosine phosphorylation of the insulin receptor, and insulin receptor substance protein is observed in peripheral tissue, which compromises insulin signaling and reduces the level of the glucose transport, GLUT4, on cell surface. So when a person do physical exercise, then in that condition GLUT4 will be increased. It will go to the surface of the cell. Role in type 2 diabetes. Insulin resistance is a precursor to type 2 diabetes. Over time, pancreas may struggle to produce enough insulin to compensate for resistance, leading to elevated blood sugar level. This can eventually result in development of type 2 diabetes. Metabolic syndrome. Insulin resistance is often associated with metabolic syndrome, a cluster of conditions that includes obesity, high blood pressure, high blood sugar, abnormal cholesterol levels. Metabolic syndrome increases the risk of cardiovascular disease and type 2 diabetes. Symptoms. In the early stages, insulin resistance may not cause noticeable symptoms. As it progresses, however, symptoms, we've just discussed that in an image, include fatigue, increased hunger, difficulty losing weight may occur. Diagnosis. Insulin resistance is not directly measured but is often referred from the measurement of the fasting blood glucose level and insulin level. Other tests such as oral glucose tolerance test or the HOMAIR, homeostatic model assessment for insulin resistance, may also be used to assess insulin sensitivity. Treatment and prevention. Number 1, lifestyle changes are key to managing insulin resistance. So this includes maintaining a healthy weight. So if a person is obese, he or she or overweight should decrease the body weight, engage in regular physical activity. Even walking 3 to 4 miles a day may be a good option, and adopting a balanced diet that is low in refined carbohydrate and sugar. In some cases, medication may be prescribed to help improve insulin sensitivity. It is important to note that addressing insulin resistance early on can prevent or delay onset of type 2 diabetes and reduce the risk of associated complication. And that's all about insulin resistance. If you have any question, please feel free to ask me. Please share the information with your friend. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.